Research is raising questions about one of the most commonly used medications during pregnancy. Researchers from Mount Sinai found evidence linking prenatal use of acetaminophen, often sold as Tylenol, to higher risks of autism and ADHD. The analysis looked at data from more than 100,000 participants across nearly 50 studies worldwide. Researchers say even a small increase in risk could have significant public health consequences, given how widely the drug is used. Joining us now for more insight on this, Dr. Catherine Bianco, the director of Stanford's Maternal Heart Program. Doctor, thank you so much for joining us this morning.
Thank you for having me. I'm very excited to be here and have this conversation.
Yeah, this is really quite alarming. I mean, for me, it's been more than 20 years since I had my last baby, but I did talk to a few of my colleagues who had babies recently, and it's typically the only pain relief that doctors recommend as safe when you're pregnant. I mean, I remember it was the case when I was pregnant. What are your thoughts on this?
Well, you're exactly correct. Pregnancy is such a vulnerable stage for the ingrowing fetus and also for the mother that Tylenol has been historically very, if you will, safe. And I think we have to put this in context. This argument has been going on for a few years now. And when you look at data, you have to see if this is an association or there's actually a biological effect that has been able to be shown. And, with disregard of this particular molecule, there are many studies that are trying to point out the causality, the biological causality, not the statistical association. So this study is very powerful from the point of view that it has a lot of participants, because what they did, they look at all the studies that are being published in the subject and trying to come up with very strict analytic statistics to really see if there is a risk there. There's some bias with the study, like any big study that has that. They started with many studies and they had to reduce it all the way to 46 studies. And they do see some association, but the reason that there has to be seen with, I would say, with a grain of salt, is that this is not a biological study showing causality. This is an association study looking at epidemiology. Very extreme, very good methodology. So what are the national organizations saying to us as I practice high-risk obstetric, maternal fetal medicine specialist, and I'm also a geneticist. What the American College of Obstetrics and Gynecology is saying is acetaminophen, that is the particle that is actually component the commercial name of Tylenol, is generally considered safe for using during pregnancy. So ECOG and obstetrics and gynecology across the country always have identified this molecule as being safe for pain relief, because the problem during pregnancy, we really have little choice. And they conclude in the study that they recognize that, and we have to understand why the patient is taking this medication. Because if we're looking at the reason to be fevers or other distress in the mother, you do not want to have to happen in pregnancy, because that can also cause other problems. As such, like fever is being related, high fever to birth defects. So how do you establish the causality here? Is the fever causing the problem, or is the medication causing the problem?
Right. I want to break in for a second, because like you said, it's aside from a fever. I mean, a lot of women take this just, they have a headache, they're uncomfortable. There's a lot of things going on when you're pregnant. So what are you recommending for women? And are you concerned about this maybe then impacting young children as well?
Very good question. We have not changed our recommendation, and I don't think we will be changing our recommendation as we follow national guidance. American College of OBGYN and FDA, and they both have endorsed this medication because there's no, at this point, any causality being shown. Another thing is, like, when we talk about the brain and the inborn brain of the fetus and then continue growing, it really doesn't stop developing until you're 50 months of age. So what it does mean when you look at those studies that were maybe done when the baby, this infant or late in childhood, 5 years, 3 years old, and you see this increased incidence for like ADD or ADHD or even autism spectrum disorder, you really don't know when really that environment in fact could have happened. If you really counted into your question when the fetal brain is being fully developed, and it could take years. So you also have to put that in context. So I don't see for like it's an important contribution to the literature, and it's always good to continue doing the research. It's important to get to the bottom of this. We all know that it's a medication that we use in a daily use for our patients, but I don't think we will be changing our recommendation at this point.
Okay. All right. That's at least some reassurance, but certainly more research I'm sure will be done from this. Dr. Catherine Bianco from Stanford Medicine, thank you so much for joining us.
Thank you for having me.